Miss, can you hear me? Hello? Hello?
Yes, I can hear you.
Are we waiting for someone to come on? This is real messed up.
Yeah, we're getting ready to start, so we'll just ask everybody to mute, please. We're getting ready to start. Thank you. Felicia?
Hi everyone. I'm Felicia, and I do want to welcome everyone to our Zoom call today. We will be talking about Introduction of Maternal Child Health by Vinita Leedom. And I do want to let everyone know that the call is being monitored. And we will go ahead and have a prayer. And then after our prayer, we will let our speaker introduce herself and then go into more details about maternal child health. Dear God, we confess our needs for you today, Lord. Please continue to guide us and strengthen us in everything that we do. In Jesus' name we pray. Amen.
Okay, hi everybody. My name is Vinita Leedom. I apologize, I don't have a camera on this computer, but I am with the South Carolina Birth Defects Program at the South Carolina Department of Health. And today I'd like to share a little bit about birth defects with you as a component of maternal and child health. And a presentation should be about 25 to 30 minutes long. And then after that, I'm happy to answer questions about anything related to this topic. So if you'd like, I can go ahead and get started. Shall I start?
Yes.
Okay.
We're mute, so we can't talk. That's why you said mute, so nobody was saying anything.
Let me make sure. Can you all see my screen?
I can now.
Okay. Let me go ahead and start it. So, birth defects are a leading cause of infant mortality, which is birth in the first year of life. And this hasn't changed in the last 10 years. They continue to be one of the top 3 causes that infants die before their first birthday. What are they? They're a structural anomaly or a malformation. So something different from what's typical present at birth. And a lot of children have them. 1 in 33 children are impacted by birth defects. Birth defects are common, they're costly, and they're critical. Why do we conduct birth defect surveillance? So why do we look for them? We want to understand if the number of birth defects is increasing or decreasing over time. We want to know what the causes and risk factors are for birth defects. We want to educate the public about birth defects and how to prevent them. We want to plan and evaluate activities aimed at preventing birth defects, refer families impacted by birth defects to services, and help policymakers allocate resources and services for affected babies and their families. In South Carolina, we are extremely fortunate or blessed to have the South Carolina Birth Defects Act. It's one of the best statutes in the country. We are allowed to conduct birth defect surveillance, so we can actually look for them and know what's happening and refer all of the children we identify to services. We have been doing this since 2006. We look at medical records for children up to 2 years of age and adults of any age with a congenital heart defect. And we look at pregnancies impacted by complications to see if a birth defect is present. We are an active surveillance program, meaning that we look in medical records and we look at all birth outcomes. So whether the baby was a live-born baby and if the mom had a stillbirth or termination, we look to find out more about the birth defect. And we follow the National Birth Defects Prevention Network's guidelines. And that is the organization that I also represent. Our mission is to understand birth defects, to develop strategies to prevent them, to facilitate research, and to refer families to services. And we have a vision that we'll have a South Carolina where healthy births are promoted, every birth defect counts, and families are supported. The three pillars that we rest on are prevention, research, and referrals. In South Carolina, we look at inpatient medical records, we look at vital records, we look at surgery data, genetic center data, and we look at outpatient medical records as well as death certificate data to learn more about birth defects. South Carolina is also one of a few states that is funded to look at congenital heart defects across the lifespan. And we actually are funded to look at children, adolescents, and adults with heart defects to see how their health outcomes are over a 10-year period. We also in South Carolina look at the impact of infections on pregnancy. We know that many infections can cause birth defects. So for some specific infections, we actually follow the exposure of the infection and we look at the outcome on birth and the impact on the child's development. We are also in South Carolina an MD StarNet state. So we look at, there's a condition called muscular dystrophy. And we in South Carolina do surveillance for this group of diseases that causes mutations in a person's genes. Over time, muscular dystrophy decreases a person's mobility, making everyday tasks difficult. We are one of only 7 sites across the US conducting muscular dystrophy surveillance. Muscular dystrophy is tricky because you don't necessarily find out about it at birth. The child can be 2.5 years of age before the parent ever notices any symptoms of muscular dystrophy. In South Carolina, since 2008 through 2021, we've identified thousands of birth defects. Over 8,000 birth defects were identified in the heart category. Heart defects are the most common kind of birth defect, not only in South Carolina, but across the United States. Next, central nervous system defects. We've identified over 2,600 defects in the central nervous system category. Renal and genitourinary, so related to the kidneys, related to the genital areas, we've identified over 2,000. And musculoskeletal, for example, if a child is missing an arm or a hand or fingers, over 1,800 of those. Chromosomal, for example, Down syndrome, Turner syndrome, Edwards syndrome, over 1,400 of those. Orofacial, which is defects such as cleft lip and cleft palate, over 1,400 of those. And then gastrointestinal, and then ear and eye defects. Unfortunately, there is a disparity in deaths for children with birth defects. So we see that children of minority babies are more likely to die of birth defects than white babies in South Carolina. And while we don't want any babies to die, the disparities are stark. This is an example of a birth defect called anencephaly. All images of birth defects are courtesy of the Centers for Disease Control. In this birth defect, part of a child's brain is missing. Spina bifida is one that might be more well-known. And in this defect, the child's spinal cord is impacted at different stages. The higher up, the more severe the case. Microcephaly is a birth defect that can be caused by many different risk factors. And in this condition, a child has a smaller than normal head size. Transposition of the great arteries is a serious heart defect that causes great morbidity and mortality. Hypoplastic left heart is another critical congenital heart defect. And these defects cause severe morbidity to the point where the child needs several surgeries in the first several years of life. And these are just a few examples of defects that we look at. Cleft palate is one that might be well known, and this is oftentimes associated with other syndromes as well. There are other kinds of defects that affect the intestines and the esophagus. There are defects that affect the arms and the legs. There are chromosomal defects that affect the DNA, but have other resounding impacts. In abdominal wall defects, oftentimes a child's internal organs will be outside of its body when it's born, and a surgery must be done to replace them and put them back inside the body. In South Carolina, we look at congenital heart defects, as I mentioned previously, and critical congenital heart defects. And this graph just shows how many critical congenital heart defects we've identified each year since 2014. And as you can see, we have nearly 100 every year, and in some years as many as 125 live-born babies born with a critical congenital heart defect. Again, there is a disparity, unfortunately, in the CCHD mortality. So the children that die with critical congenital heart defects. Black infants diagnosed with a critical congenital heart defect had a 1.5 times higher likelihood of dying than did white babies. And please note that in the study, the cause and timing of death was not reviewed. We just know that in our cohort of children born with this defect, they were 1.5 times more likely to pass away. And so this is another cause of interest and important for us to study and understand so that we can improve outcomes for all babies. So I know that this group is probably very interested in learning more about how to support birth defects prevention, research, and referrals. So I've sort of shifted the remainder of this presentation to focus on how we can support this important cause. The CDC considers folic acid fortification to be one of the greatest public health victories of the 20th century. We know that if a woman takes folic acid early in pregnancy, within the first 6 weeks to 8 weeks, and even before pregnancy, she is much less likely to have a baby with a birth defect such as spina bifida or anencephaly. The Greenwood Genetics Center in South Carolina also has a very great NTD prevention program. The Adler flour mill, excuse me, which many of you might recognize, this is in downtown Columbia, was one of the first flour mills in the country to fortify their flour with folic acid, with folate. And this allowed women to receive folic acid naturally through their food. And folic acid is available and present in high quantities in leafy greens and other products. However, in order to ensure that women got the appropriate amount, now you can look at cereal boxes that'll say folic acid on the side. And that is just one method to prevent one kind of birth defect and when it is preventable. There are some NTDs that happen because of genetic reasons, and those are not considered to be preventable, but many of them are. So here it is. Here's a beautiful picture of the kinds of foods that carry folic acid. And getting 400 micrograms a day can help prevent neural tube defects. A lot of women are not regularly seeing healthcare professionals. This is one of the best things that somebody can do, even if they're not planning to get pregnant, is to see a doctor regularly, because the physician or medical provider can identify issues which might cause birth defects in a pregnancy. Alcohol can cause fetal alcohol syndrome. Cigarettes are associated with pretty much every kind of birth defect outcome you can think of. Marijuana has been shown to cause developmental delays in infants and children. Infections can also cause birth defects. And interestingly, so can overheating in pregnancy. Diabetes is a risk factor for many, many birth defects. And I was looking at your website. I noticed the last presentation, or one of the presentations, was about diabetes. So I, kind of piggybacking on that, diabetes can also help. Preventing diabetes can also help promote healthier pregnancies. So striving to reach and maintain a healthy weight should be a key goal for all organizations focused on health and well-being of children and infants. Vaccinations, such as the rubella vaccine and others, can help prevent birth defects as well. It is important and critical that every woman be up to date on vaccinations and consider getting the flu shot, because there have been preliminary studies suggesting that influenzas of all kinds can have potential harmful outcomes on both pregnancy and birth outcomes. Now, when we think about what we can do in the area of birth defects, referrals is key. So preventing secondary disability is something that we are all very much focused on. And this is early intervention, that sensitive period in a child's life between 0 and 3 years old. And I, as a program manager in this field, have been very surprised by the number of infants that we actually refer for the first time who were somehow missed by the system. Many children are not raised by their immediate parents, or they might be sort of lost in the system, and the referral is never made. Greenwood Genetics Center is another organization that takes referrals for neural tube defects, and our state's first sound early hearing detection and intervention program is supporting families that have babies with hearing loss. This is a visual to help to illustrate how one thing influences another. When a child is born with a birth defect, for example, with hearing loss, it can impact both the way they speak, the way they hear, so there's the ear, the way they speak, which is the microphone, because if they can't hear, they might not be able to speak properly, and the way they learn, because if they can't hear, they're not going to learn at the same pace that other children might be able to, among other risk factors, other things that might happen to them, such as mobility. So this is just a visual to sort of illustrate why early intervention is really important. If you can intervene early and help that child improve their hearing, their speech, their learning, you improve all their birth outcomes throughout the trajectory of their life. In South Carolina, early intervention offers free therapies such as speech, physical, and occupational to children between age 0 and 3. And anyone can refer a child for a free screening. So this does not depend on a parent's income. It does not depend on the child being identified by a healthcare provider or a teacher. Anybody that knows a child that might be in their care or someone they are close to might be able to can refer a child to early intervention, which is BabyNet in our state. And this is maybe one of the best things that can happen for a child with a birth defect, is to get into therapy early. And those therapists oftentimes identify other things that they can refer the family for completely free of charge. So I know, for example, some families who didn't know that they were qualifiers for early intervention, they thought their income was just a little bit too above the level acceptable, but anybody can be referred and receive free therapy. So they were thousands of dollars paying out of pocket before they realized they were eligible for early intervention for free. In South Carolina, we have referred over 3,500 children since 2018 to early intervention. Some conditions are not automatic qualifiers, but it doesn't matter. You can call and schedule an assessment with one of the early intervention counselors, and they can identify your child's eligibility based on what milestones they have met. Muscular dystrophy also is a condition that needs referrals and assistance. And these are some of the care centers across our area that might see children with muscular dystrophy. Excuse me. Hearing loss is also a program, or also a condition that many children in South Carolina struggle with. And I have listed here our first sound manager, Tara Carroll, and her phone. And I also have listed Beginning South Carolina, which is an organization dedicated to supporting children with hearing loss. At DHEC, we also have the Children and Youth with Special Healthcare Needs program. And this program, they support care coordination for eligible families through referrals, care coordination, and transition assistance. And they can also help provide payment assistance for medical supplies, services, orthodontics, such as braces, services and supplies for hearing issues. And they also have a great camp called, excuse me, Camp Burnt Gin for children, I believe up to 25 years old, 7 to 25, who have special needs. I'm stuck. Let's see. Oh, here we go. So as potential policymakers or people interested in policy, when you think about birth defects, there are many opportunities to intervene and support policy. So ensuring that women enter prenatal care early and not assuming that they don't need it, or that maybe people are not sexually active, making sure that people are in care and entering prenatal care early is one of the best things you can do to support the prevention and the care of people with birth defects. Improving ultrasounds and sonography would be another great move for our state and all states in order to identify birth defects early. Identifying the critical congenital heart defects and other issues at birth. And then afterward, in the pediatric setting and emergency room settings, ensuring that people are familiar with birth defects and know how to refer them to services are great opportunities for policy change. In South Carolina, we do have the Emerson Rose Act, named after Jason and Susan Smith's daughter, Emerson Rose, who tragically passed away with the congenital heart defect I believe in 2012. This Act requires every birthing facility to perform a pulse oximetry test to ensure that the child has been screened for critical congenital heart defects. So that is one statute in our state that allows us to track whether or not a child has a critical congenital heart defect as much as we can before they leave the hospital. So opportunities around this. In our state, at DHEC, we're also doing a study to assess the timing and mode of CCHD detection. So we want to know how and when were critical congenital heart defects caught by our state since 2014. And we're doing medical records review to understand that. Some of the questions we have are, did mothers of infants with CCHD receive appropriate prenatal care? And we want to know that because obviously if you're in care early, you have a better chance at a better delivery and better outcomes for the child. We plan to survey healthcare practitioners and work with cardiologists, DHHS, and other partners. And we plan to do a webinar in the spring to share the information we've gained. And these are just examples of some of our upcoming publications. So in summary, we at the South Carolina Birth Defects Program are very excited to partner with anyone that might be interested in birth defects prevention, research, and referrals. And I'm very open to sharing any more data with you all or any questions that you might have. Thank you.
Do anyone have any questions or comments?
What was young lady's name?
It's Vinita Leedom.
Could you spell that? Anita?
It's VINITALEEDOM.
Goodness, V-I-N-T. I can't write that fast.
Yeah, I'll just put it on the screen so you can see it.
Okay. Oh, there you go.
Yeah. But if we could impact the birth defects rate, we could impact the infant mortality rate. And those children that have birth defects deserve a better quality of life. And the way we can do that is by getting them into early intervention therapies early and making sure that they're well known.
Kathy Ford asked a question about immunization. Can you talk a bit about that?
Yeah, sure. So it's known that many of these classic kinds of immunizations, measles, mumps, rubella, they have an impact on whether or not a birth defect can occur. So we know that children that are in fact infected with certain infectious conditions in utero are more likely to have outcomes that can be debilitating, such as birth defects. Can you comment on the link between birth defects and maternal drug addiction? There has been some research on gastroschisis, so certain of these musculoskeletal, these abdominal wall defects. There has been some research suggesting that women, maternal drug addiction might have an impact on those outcomes, increasing those outcomes. So obviously there's other things too, like there's opioid disorders, neonatal abstinence syndrome. Those are not necessarily considered to be birth defects, but they're syndromes present at birth, but they're absolutely important and critical. And we are very concerned about that. CYSHCN is the Children and Youth with Special Healthcare Needs program at DHEC. Is receiving folic acid through foods naturally better than with pills? I'm not really sure about that, but I do think that it's to be safe. It's good to take the folic acid supplement. I have taken both. Like I try to, I've tried to increase my leafy greens as well as take the supplement. It's just really hard in our kind of modern day diet to get all of those leafy greens and kinds of fruits and vegetables that help to give you the level of folic acid needed. So it's not a bad idea to do both. But I would never tell anyone not to eat more leafy greens. So if that's the question, they should do both.
I have a question.
Sure.
Do doctors make referrals? Yes.
So this is a good question. So we know that doctors make referrals, but we know that one, at the hospital, the family isn't always ready to get the referral. So like if you have a medically complex child that might need heart surgery, when you come home that day with your baby that, you know, you're like wondering will survive, and you got a call from someone saying, would you like to have, you know, speech therapy or mobility therapy for your child? What I'm learning from my research is a lot of families aren't ready then. They're not thinking about, you know, therapies. So I think the key is being referred twice won't hurt. Sometimes they do forget to refer families, or sometimes the families are not they're not reachable with the information the hospital has. So it wouldn't hurt to refer a child again. And that's something we've learned from our research and from the referrals we do, is sometimes we refer a child later, they've already been referred the first time, they didn't make it in. The second time with our referral, it was a better timing for the family. So that is something to consider. How is the agency publish the availability of care prevention to those most in need through schools? So we are looking into different ways to do that. We have a social media person that we've hired, and we've been doing social media during Birth Defects Awareness Month, which is January. However, the prevention tips are also very readily available online and something that we can share in other ways as well. Are you aware of environmental factors that affect birth defects outcomes? So that's a really good question. I mean, we know that there are risk factors. For example, if you look at radiation in places where there have been nuclear waste sites, like, you know, Chernobyl, you see birth defects for, you know, sometimes generations. So we know there's risk factors like that. We know there's certain chemicals that affect certain types of birth defects. We track that as well. So for example, if there is documentation of an exposure, we collect it. And then there's some more in-depth research studies that suggest certain environmental risk factors cause birth outcomes. But when we think about the environment, we are also talking about the maternal environment. So like a mother's drugs, like the drugs a mother might be taking, both prescription and non-prescription. That was what we saw with thalidomide, right? Thalidomide, where infants were born without, limbs, and it was a physician that noticed first that in Europe that this was happening. And so in the United States, they really didn't allow it to be used very frequently, but it's oftentimes a physician that notices a medication might be causing a birth defect, because that kind of research isn't allowed on women who are pregnant. So unfortunately, sometimes you don't find out because they've only done the research on mice.
What about cat litter boxes?
You're such an informed bunch. Now I kind of wish I know how to improve this presentation. So toxoplasmosis is a risk factor for microcephaly and other birth defects. So yes, so toxoplasmosis is a organism that lives in feces of cats. And that is why we do recommend that women who are pregnant don't change litter boxes. And it isn't something that's like a deal breaker. Like you don't have to get rid of your cats or anything like that, but like take extreme caution, use gloves, use a mask, everything you can just to make sure that you're not exposed to cat litter. But that's a great question. So yes, toxoplasmosis is an organism that can cause birth defects.
So let somebody else do that chore.
Yes.
While you're pregnant.
I would recommend that highly. Yes. I mean, when I was pregnant, I definitely had other people do the cat litter. And then, like I mentioned this briefly, but alcohol in any quantity isn't considered to be safe in pregnancy. The problem with fetal alcohol syndrome is you can't really see it at birth. So like if a person is drinking a lot in pregnancy, the baby might seem, most of the time fine at birth, but it's like over time we see developmental issues and delays that are caused by excessive alcohol. So, if that is a consideration, really discouraging alcohol during pregnancy in the United States, that's what we promote.
I have a question. Can you hear me, Pamela?
Yes.
Oh, okay. So far as this workshop, are you asking us to help get a law, in the legislative realm, or are you just wanting us to let people know about birth defects?
Yeah, so I am a government employee and I am not advocating or speaking with legislators or suggesting specific policy actions for you all to do. My recommendations are to follow scientific best practices and share that information with your congregations and the folks you might have an influence on, especially insofar as early intervention is concerned. Many people, more than we realize, have contacts that might benefit from early intervention services. So just sharing the information with your congregations would probably be really helpful to the people in South Carolina who have birth defects.
Okay, thank you.
Thank you. And I apologize for not clarifying that earlier.
Is there a common birth defect, one that is more common in this state? What is the most common?
Heart defects are the most common birth defects in South Carolina. So babies born with a heart defect. It's actually one in. It's a very it's like a pretty high number. Excuse me. Yeah. So I can go back to that. I kind of breezed through that, but let me go back to that slide. So if you look at this slide, this shows like kind of the distribution of birth defects in South Carolina by category. So as you can see here, these are congenital heart defects, cardiovascular defects. So since 2008, there have been over 8,000 cases identified. And then second most common are brain anomalies and anomalies of like the nervous system. And the third most common are the renal and genitourinary, so like kidneys, genitals, those are the third most common.
I didn't get that when we went through that chart so fast.
I apologize. Yes, thank you so much for asking the question, but yes, it is heart defects that are the most common.
And I remember on one of your slides, I think you also said that you monitor pregnant women who were exposed to certain diseases. And I think you list Zika and then COVID.
Yes.
Well?
Yes.
Okay. So the reporting, when do you think you will be reporting out in regards to COVID in any friends that
So CDC has put out several publications related to COVID-19. We do collect the data here. There doesn't appear to be a link between COVID-19 and actual birth defects. However, COVID-19 has a detrimental impact on pregnancies. So we have seen that. And I would be happy to share some of the links from CDC because what they're doing is they have a much larger sample size. And that's where, you get the good statistics and the bigger data sets can help us see things better. So like they're collecting data from several states on this project and they're looking at that. And so I'm happy to share some of their publications with you. And we know that Zika absolutely has an impact on birth defects. So children with Zika are more likely to have, or the mother has Zika, are more likely to have brain problems such as microcephaly, small brains, eye problems, hearing problems. And that was something we learned from Zika virus.
Okay. I have a child with,
I'm sorry, what's that?
I have a grandchild that has autism. Where does that fall in this category, or do it at all?
Yeah, we currently do not do surveillance for autism. However, many of the children who have other birth defects also have autism. So we do recognize it and we see it in some of the medical charting, but we currently don't look for autism on its own.
Okay. Thank you.
Yeah. Well, I really appreciate your time today, and thank you all so much for inviting me to come speak with you. I see a couple other questions. Thank you so much. I think there's one more question. Do you see any correlation in easy access to healthcare and birth defects and maternal and child health? So we are very interested in this question because we have a lot of rural areas in South Carolina where people might not have easy access to a provider. We know that without access to a provider, you're less likely to be screened for certain birth defects. And that means that you're less likely to maybe have an appropriate delivery. So for example, if someone doesn't get prenatal care early and they have a critical congenital heart defect, that baby might need to be born at a higher level facility, such as MUSC or Prisma. And if the child isn't found early, then the child might not be born at a facility ready and equipped to handle complex heart defects. So we're doing a study on this right now. I don't have the results yet, excuse me, but we are very interested in knowing whether or not women with critical congenital heart defects are getting care early. And if they're not, is it because of their rural status? So we definitely understand there are limitations geographically to accessing providers and other limitations as well. So this is something we're looking into. And again, looking forward to sharing the results so that we can improve outcomes. There's another message. How is it tired? I'm sorry, I don't understand the question.
Is the level of abortion tied to potential birth defects? In other words, do people seek abortions if they're expecting their child
Oh,
to
yeah. Oh,
with
very nice.
birth defects?
So we know that we look at medical records for all birth defects, regardless of what the outcome was. So whether or not it was a live-born baby or an abortion, we look at all of the medical records. We do know there are many cases where there are babies mothers that had a pregnancy impacted with a birth defect where they sought an abortion. But I haven't compared that. Like, we don't have access to abortion records for anyone. We only look at those that have a birth defect. So we definitely know that there are many cases in our system where the child had a severe birth defect and there was an abortion, but I don't have the data for everyone, so I can't compare it to like the general population and why people get abortions or anything like that.
That was the question that was in the chat that you were having trouble understanding.
Yeah, but I mean, early prenatal care is one of the trickiest things to do, right? Because I'm sorry, was somebody saying something? Are there any other questions? Great presentation. Thank you so much. Is anything being done presently to accommodate those who are not having access to assistance? So DHEC has a care line that anybody in South Carolina can call for questions related to various things that that might impact their ability to access care. And I'm happy to share that information with you all. I don't know what else is being done. I know that there's many organizations such as Healthy Start that are very interested in supporting pregnant women. WIC is a great partner as well for women who have had a previous baby or have had a baby already. They're a great contact, and they, are interested in best practices. Also, our family planning clinics in South Carolina can also assist in connecting women to prenatal care as well, and prenatal vitamins. So those are just some examples. PASOS for Hispanic families as well. Is Medicaid available for these families? Yeah, so Medicaid is income dependent, and I believe that anybody in South Carolina who is pregnant with a certain income is eligible for Medicaid, but I don't know enough. I'm happy to look that up.
Hey, may I ask a question?
Absolutely.
I'm horrified by the statistics in South Carolina for so many maternal deaths and infant mortality. Do y'all have data that weeds out the effects of the mother's possible drug addiction, or if you know that there's drugs that caused a birth defect? Do you have a way to screen that out of your data so that you can more fairly find it, not fairly, but can you make a different assumption about how many have died from other things besides the mother's use of drugs, or alcohol and drugs?
Yeah,
I'm just curious.
That's a really good question. So we know a lot of birth defects are actually genetic as well. And so that means that there was no impact, there's nothing, as far as we know, there was nothing that a family could have done to prevent the birth defect. So that being said, there can be multifactorial reasons for a birth defect. So it can be a combination of genetics and diet, or a combination of genetics and environmental exposures. It can be just genetics. So it's really hard to tease that out. But I agree with you. I mean, I think it's an important question to ask whether or not we remove those that had a drug exposure, but it's not typical to see a lot of drug exposures in these outcomes. So that is a problem, but it's not as prevalent, I think, in this data set as you might think. Some of these are genetic conditions. Some of these are related to prescriptions that were legitimate prescriptions as well sometimes. So it's really hard without looking at each individual case to know what might have possibly been the cause, but it's hard to know that.
Okay, just to make sure, but you say most of these defects are not from drugs and alcohol. They're from those other conditions, environment, diet and genetics.
Well, and yeah, so drugs and alcohol have an impact, but they're not the majority of these.
Okay, great. Thank you.
Yeah.
One thing I'd like to point out about the alcohol fetal syndrome, we think that it's always visible with the features on the face, but that's only true if the alcohol was ingested while the face was being developed. If it was ingested at other times, the impact will be on other developmental features of the child that may not be visible. I just wanted to point that out. The face is developed early in the pregnancy, so only the alcohol that's ingested early in the pregnancy would be seen through the facial features.
And I have a question to ask also. Can you hear me?
Yes.
When I noticed the kids from Africa, when they show different things on screen to get help from certain birth defects. So I'm thinking with them over there, they're not getting the medical care during their pregnancy because kids have all types of birth defects, I noticed. When they reveal certain things on TV with their legs, the legs being very bowed and also the lip thing, the thing with the teeth coming out of the lips or something like that. I don't know if that due for the lack of care or what it is. And just to mention to some people, which you might not want to ask, it was mentioned on The View the other day, if you're getting ready to marry somebody, find out what disease run in their family. You
Yeah,
know,
so
say-
that's a good question. So genetic counseling, if you're in prenatal care, if you're seeing a doctor, a lot of times they will recommend a genetic counselor for certain risk factors. Anybody can ask for that too. So like, it's not a bad idea if, it's appropriate, but the physician's usually the best person to decide, but every person should feel empowered to ask their physician if they think they should get genetic counseling. And we do have genetic counselors across our state. So I definitely think it's a great question to ask your physician, especially if you know of things in your family.
No, I mean, if you get married to somebody, you don't know their history. You ask that person. That's what I'm saying.
Right. And someone asked about the total number of birth defects as compared to the years. So this is a cumulative total for 2008 to 2021. And so the proportion listed here would be the same. I don't have the prevalence on these screens, so the rate, basically, I don't have that on here, but this is just to show you the impact in terms of the frequency of how many people had a birth defect in each category. But again, I'm happy to share that.
I know in Africa, in other countries, if the baby, if it's born in most, and where there's a good hospital, if they have that cleft palate where the teeth aren't, the lip is kind of strange looking, they fix that right away, But if they don't have access to that kind of doctor or ability to do that right away, then, that's when it gets worse and worse as they get older. So there's a lot of things they can do right away if there's care available.
Right.
I'm so happy that United Methodist, y'all might not know this, but United Methodist help a mission in Africa that I know about because I got to go there. In Angola, it's called Kesawa, and they have a hospital there. And it was destroyed during all that warfare and that lasted like 30 years, but it's built back again now. And they've got students and people from the world, all missionaries and others that work there for the surrounding villages. It's a great little mission. Well, they have a school, and but you can volunteer to go over there. There's a woman in Florida that takes a group every year, Sandy Goodman, and it's through a Methodist church in Florida. But I got to go because I got hooked up through my cousin who works in Kesawa. But I just think most people in South Carolina have never heard of it. So you can join up with that sometime. It was life-changing for me. And it's a safe place to go. In some of the developing countries, you worry about your safety, but these, people take care of you. They've got dorms for us and things like that, good food. But I know it's a problem in South Carolina. I'm sort of off the subject now, but since you brought it up, there's really a need around the world for good health care for everybody.
Oh, I hear you. I mean, there's some really good books out there just about, families around the world trying to access the medical care that could diagnose the birth defect. So that's something, sometimes I feel like we might take for granted here, is that if there is a possible problem, we can be made aware of it. If, not everyone has the same access to resources, but we're more likely to get any access at all. And there's some places, for example, in Iraq where, children might have birth defects or heart defects, and the family just knows there's something wrong with the heart, and they just, wish they could have a surgery or a doctor look at the heart, and at least they would have some idea of what's going on. So, I mean, I think it's really, I'm so impressed by like, your worldview of thinking globally. But yeah, we definitely are I want to say we're very blessed in the United States, and that we do have centers where we have excellent physicians who can identify problems. And, I agree. I agree with what you're saying.
Thanks. Yeah, it's about all we can do is give our money. I mean, not everybody can go into the mission field. We can do what we can, and we can pray. And I just think we need more world care. It shouldn't be right. It shouldn't be that you have to live in the United States or to get good health care. I think.
Well, in the United States, depends on where you're located at. Even in Mississippi, in some parts of Alabama, it's like a third world country. Some of them don't want to support Medicaid, so it's not. We have problems over here with that also.
Yes, ma'am.
That's a really good point. Yeah.
I would like to add something to that. Our United Methodist bishop, which I'm sure everybody here knows, that he travels to Africa with groups very often. And one of his travels is to South Africa, where he goes to Africa University.
Liberty University, he supports that.
Where he goes to Africa University. And with that trip, there is an orphanage very close by Africa University that's United Methodist supported, and also a hospital. So if anybody is interested in supporting one of those missions, all you have to do is go to our United Methodist website, and you'll see those missions there. But I just wanted to put that out there. We do travel there, and we do support, and it's like you said, the need for much more.
I went to a village in Angola, and the children, were running around. They didn't have much in the way of luxuries, but I think a child would love growing up there because animals are everywhere. There's lots of goats and chickens and dogs, and you're just in nature, but I guess it's tough when you get old and have to live and not have all the conveniences that we're so used to. But they live and they prosper when they are able to work and have some education and health care. You don't have to live in a fancy place, but yes, you have to have those basic needs met.
And then the water support that the Methodist Church provides to clean drinking water, that's provided in different places.
Yeah, that's like so important, isn't it?
Yeah.
But in some of those places where we would be sick if we drank that water, they can get by with it. Their body has become, but some of places have no water. And so, but all of it is important to have good water and enough water.
I don't want to beat Mississippi up, but they have problem with water today, this year.
I understand. Yeah, we took up money for them in our district.
Yes, and they is aware of it, and they're not doing anything about it.
Yeah, because it's a minority population.
Yes, that's
and
right.
When they're not represented in government like they should be. And that's the whole thing. If you're not in government, you are sunk.
Yeah.
That's why everybody needs to vote. Vote for some people that will represent.
But they were saying in the View today, with all these shootings, you need to get out and vote and get them out of office.
So true. That's right. And women need to run because here in South, if you're not represented at the table, you'll be on the menu. I love that.
Yeah.
And ladies, you all.
And women have broader thinking than men. Men think with the left side of their brain. Women, we think with both sides. We look at both sides.
We're used to taking care of people.
That's right.
So ladies, we're gonna circle back around to our speaker to see if there's anything else she needs or would like to share with us before we wrap this up. So again,
Yeah, just thank you so much for inviting me. I'm just so happy and excited to see how much compassion there is in this group. So inspiring. I bet you do so much that I don't even, I have no clue all that is done in this group. So thank you for sharing your time with me, and I hope to connect with you all in the future.
Thanks for
Thank
coming.
you.
Thanks so
Thank
much.
you.
Bye.
Bye.
thank you.
Bye, everybody.
Bye.
Remember, our last session is this Saturday. I'm sorry, next Saturday, not this Saturday. Last Saturday of February at 10 o'clock. Food insecurity will be our focus.